Hello everybody, welcome to another episode of Doc Talk. I'm Dr. Michael Bracchio here at Velocity Sports Rehab, and in this video we're going to go over heel pain. One of the most common causes of heel pain is when there's pain in the plantar fascia, which is called plantar fasciitis. The plantar fascia is a band of tissue that connects your toes to your heel. When the plantar fascia becomes painful, typically you'll feel the pain on the inside of the arch and also right in front of the heel bone, which is called your calcaneus. The pain in the plantar fascia is typically worse after a prolonged period of inactivity. The most common time is the first couple steps in the morning after you've been laying down all night, but it can also be if you've been sitting for a long period of time and then you get up to go walk. Plantar fasciitis is considered an overload syndrome. What this means is that the load that we're placing upon the plantar fascia is more than what it can tolerate. Two common scenarios for the development of plantar fasciitis are in either runners or in the pregnant population. What happens in runners is that we've either increased our mileage or our frequency of running too quickly, which places an increased load on the plantar fascia. In regards to pregnancy, there's an increase in body weight, which increases the load that's being placed upon the plantar fascia. There are a couple things you can do at home to help decrease the pain of plantar fasciitis. One thing you can do at home is do either self-massage or self-myofascial release. What you'll need either a lacrosse ball or a golf ball, and what you'll do is you'll slowly roll on the bottom of the foot for between 30 and 60 seconds. Before rolling, you can also place the ball in the freezer, which will help decrease some of the pain on the bottom of the foot. Foam rolling and stretching the calf muscles can also help with plantar fasciitis. This is because the fascia from the bottom of the foot wraps around the heel and blends into the muscles of the calf. So if the calf muscles are tight, they can create a little bit of tension on the plantar fascia as well. Another option is to use rock tape or kinesiology tape to help decrease some of the pain of plantar fasciitis. The way rock tape works is that it stimulates the receptors in the skin, which will help decrease the pain of plantar fasciitis. So I have two strips of tape that I've already cut. What I'm going to do is I'm going to rip the end here so I can lay it down. The first part that I'm going to do is I'm going to tape the bottom of the foot, just kind of right at the ball of the foot is where I'm going to tape. And then what I'm going to do is I'm going to slowly roll the tape up, putting no tension on the tape so that it gets that inside arch. And then I'm going to continue along the Achilles tendon onto the calf. And then I'm just going to rub along the tape to make sure it sticks to all the places that I just laid it down. And then the second strip, I'm going to flip over here. And so I'm going to give myself a little bit of an arch support. So again, I'm going to rip the end. I'm going to place a tab on the outside of the foot. And then I'm going to wrap down underneath. I can give myself a little bit more support by stretching the tape just a little bit to pull up that inside arch. And then I'm just going to lay the tape up without any tension. And then again, just rub the tape to make sure it sticks to the skin. And so, bottom of the foot looks like that. And then back of the foot looks just like that. If home treatment isn't working, or if you just want to increase the speed of recovery, there are a couple things in the clinic that we can do to help with plantar fasciitis. One thing we can do is soft tissue therapy to both the plantar fascia and also the calf muscles, either by hand or with a tool called Graston. These therapies stimulate the receptors in both the plantar fascia and also in the calf muscles, which will help decrease the pain of plantar fasciitis and also to loosen up the tissues. Once we've decreased the pain of plantar fasciitis, we'll want to start a rehab program to build strength in the foot and also in the lower leg. The first thing we would do is to make sure we have motor control of the small muscles of the foot. Once we've learned how to control the muscles in our feet, then we can start some isolated strengthening exercises to help strengthen the bottom of the foot. An exercise we would do would be like a towel crunch. After we've built some isolated strength in the foot, then we'll progress to some more complex movements, such as a heel lift. This will help integrate all the isolated strengthening exercises that we've done for the lower leg so that we can safely return to walking or running. Thank you guys for watching another episode of Doc Talk. I hope that you found this useful. If you did, please like and subscribe to our channel.